Good morning, everybody. Welcome to another Mancoll Minute. Hope it's been a great week for you, like it's been here. Today, I'm going to kind of address a topic that's I think really confusing for folks interested in breast augmentation or who have implants, and maybe have implants for a while. Is how do you monitor them for rupture or them wearing out? A leak is a term that's used. It's confusing because there's kind of what we recommend as plastic surgeons, I think, and I think we're pretty consistent across the board. There's kind of the stuff you read on the internet, which was sort of what some FDA stuff that they had originally proposed but did not get approved when it was all said and done. So let me just try and give you sort of my take on what should be done for folks. First off, the stated rupture rates, and within a few percentages they vary a little bit by manufacturer. Some manufacturers try and highlight how much worse other manufacturers are, but when you dive into the data, it's not quite as straightforward as one number might suggest. And I won't go into that kind of stuff, but across the board, I tell folks the rupture rate of a silicone gel implant that's been put in probably in the last 15 to 20 years should be somewhere in the neighborhood of 8 to 10%, okay? Which means that 90+% of people are doing well, and this is a 10-year rupture rate. All right, and we use 10 years mostly, I think, for the fact that the warranties are 10 years when you're putting them in for cosmetic purposes. For those that haven't put in for breast cancer, kind of the warranty is not quite as important because insurance typically will cover this. But with that said, there's no like turkey timer that pops up and says your implants are done, okay? If you have a saline implant, I guess one of the advantages is it deflates over a couple of months, you get more wrinkling, and the size simply changes, and that's generally an indication your implant's gone bad and time to be replaced. But with the silicone gel implant, which is really just a bag of silicone with silicone gel inside, your body creates a scar called a capsule, and typically once the bag breaks, the gel is kept within that bag. And because these are cohesive implants, not like the ones that sort of were around when I first started my training back in the early 90s, those were more like molasses, whereas these are kind of like those toys when you squeeze them, the eyes bug out, and when you let go, they suck back in. I mean, they're a lot more stuck together. So it's not like fluid just rolling around. But what happens is they kind of start to bleed out a little bit, and then you finally get a rent in the capsule, in the actual bag, and now it's all kept within the capsule. So the vast majority, I mean the overwhelming majority of these that I take out that are ruptured, all the gel is kept within this scar. So you don't get this big massive scar or deflation. But what I think typically will happen is you'll have an implant that felt great for years and then little by little started to feel harder and firmer. And that's usually an indication when folks come into me, they've had implants for 10, 15, 20 years, that there's probably something wrong. Typically, we're going to start with a mammogram to assess that because that's kind of the way insurances go. Mammograms, though, are not overly sensitive in determining that. The number is roughly 50%. It might vary a little bit, but that's the number that I sort of always have gone by. And then if there's still doubt, then we might go to an MRI. But there's no routine use of an MRI to follow an implant. That was actually one of the original recommendations, was to say every 3 years a woman should have an MRI, but there was no data to suggest that was a reasonable thing to do. Extremely expensive, who's going to pay for it? And the rupture rates at that time, when we're not even sure if an implant ruptured, how problematic that is for a patient from the very beginning. Because again, after all the studying, after a decade or more, from 91 to 2006, looking at data and illness associated with implants, they really couldn't pin their finger on autoimmune disorders, fatigue symptoms, rheumatoid, simply because of the presence of an implant or even a rupture. Now, there's a whole bunch of folks who think they've got something called implant-related illness. I'm not here to talk about that today, but there's some folks that I think implants aren't right for them, and there's other folks that don't think it's right, but when they take them out, they don't feel any different. But the fact is the MRI is still not 100% sensitive, and it can be very specific. There's something called a Linguini sign, where the folds of the implant kind of look like spaghetti. It's kind of an indication of rupture, but that's not an absolute. So typically, if I have a patient who has a clinical history suggestive of it and they've been in long enough, we may or may not go through the steps of all the imaging, because a lot of times those folks come in and say, I've had these for 20 years, I don't like the way they feel now, and I just want them out. There's very few, and all the time I've done this, that have kind of a good feeling implant that grade 1 or 2 capsule that we talk about, that is actually a ruptured implant. Almost all the ones I take out that are ruptured are typically 3s or 4s. Now that's anecdotal, that's not based on a study, but that's my own sort of sense of the way things are. So if you are someone who's worried about your implants ruptured, I would tell you, have a conversation with your plastic surgeon. Kind of explain what your worry is and let them sort of sort out the information, and then help make a good decision. Okay, this is the next thing we should do to determine this. You know, mammo, maybe MRI. I mean, ultrasounds may have a role in the future. I've not seen where those are routinely used, and I certainly in my own practice have one, an ultrasound, but I don't think I could determine rupture with that. Not with the implants we put in today. So it just, if you're from out of town or you had your implants placed 20 years ago and you've moved, just find someone in your community that you're comfortable with, you've heard good things about. You're welcome to come in and see me if you're here in this area. I do take out a lot of implants and put a lot of implants in every year, and happy to kind of go through the steps with you. But hopefully that's some general information about the process. And mostly I want folks not to really stress and worry about an implant when it goes bad. It should come out, that's the recommendation, but it is not a health emergency. It is something that should be done, but it can be done in a sort of a reasonable fashion with, you know, taking all the proper steps. And then you gotta decide what you're gonna do when you take it out. And that's a conversation for a different video. Otherwise, have a great weekend. Talk to you soon.